Hello everyone, welcome to the channel. Today, we're going to talk about a topic that affects millions of people worldwide, anxiety. But don't worry, because our goal here is to help you understand what's really happening in your body and mind when anxiety shows up, and, of course, how to deal with it in a healthy way. If you've ever felt nervous, worried, or had that constant butterfly feeling without any apparent reason, stay until the end because we're going to explore causes, types of anxiety disorders, and practical strategies to improve your quality of life. If this topic interests you, don't forget to like the video and subscribe to the channel for more content like this. So, let's get started. Introduction: What is anxiety? Anxiety is a natural reaction of the body when facing challenges or threats, forming part of our defense system that helps us deal with dangerous or complex situations. In moderate amounts, anxiety keeps us alert and motivated, but in excess, it becomes a problem that affects both mental and physical health. Differentiating occasional anxiety from anxiety disorders is essential. While the former is temporary, anxiety disorders are chronic conditions that impact social, professional, and personal life, requiring appropriate interventions. Main types of anxiety disorders. Anxiety disorders present different manifestations and particularities, though they share the central aspect of heightened fear and apprehension. Among the most common types are generalized anxiety disorder, GAD, characterized by constant and excessive worry about various aspects of life, such as work, health, and personal safety. People with GAD often anticipate disasters and find it hard to control their worries, which can lead to fatigue and irritability. Panic disorder involves sudden and intense episodes of fear and discomfort, known as panic attacks. During these episodes, which can last from minutes to half an hour, a person may experience palpitations, shortness of breath, excessive sweating, and fear of losing control or even dying. Specific phobias, irrational and intense fears of particular objects, animals, situations, or activities, such as heights, injections, closed spaces, or flying. This fear is disproportionate to the real danger, and the person often avoids the phobic situation or object. Social anxiety disorder, characterized by an intense fear of being judged or rejected in social situations, leading to avoidance of social gatherings and events. This type of anxiety can significantly limit an individual's social and professional life. The variety of disorders reflects the different ways anxiety can manifest, and understanding the specifics of each helps in seeking the most suitable treatment. Causes and risk factors. Anxiety is influenced by a combination of biological, psychological, and environmental factors. Genetic factors: people with a family history of anxiety disorders are more susceptible to developing these issues, indicating a hereditary predisposition. Stressful environments and traumatic experiences. Stressful situations, such as losses, major changes, and traumatic events, can trigger or worsen anxiety, especially when emotional and social support is lacking. Chemical imbalances in the brain. Altered levels of neurotransmitters like serotonin, dopamine, and norepinephrine are associated with anxiety symptoms, directly impacting how we respond to stress. Lifestyle and health factors. Poor sleep habits, inadequate diet, lack of exercise, and overuse of substances like caffeine, alcohol, or drugs can aggravate anxiety. Lack of physical activity, for instance, is linked to increased cortisol, stress hormone, levels, intensifying anxious symptoms. These factors combine to contribute to the development and severity of anxiety symptoms in each individual. 4. Signs and symptoms of anxiety. Anxiety symptoms affect the body, mind, and behavior, creating a cycle that can be difficult to break without proper interventions. The most common signs include physical symptoms: palpitations, increased heart rate, excessive sweating, muscle tension, tremors, headaches, dizziness, and shortness of breath. These symptoms are triggered by the body's stress response system, preparing it for fight or flight. Emotional symptoms: feelings of restlessness, constant fear, excessive worry about hypothetical problems, a sense of permanent alertness, and vulnerability. The person feels unable to relax or enjoy moments of calm. Behavioral symptoms: avoidance of situations that may cause discomfort, irritability, difficulty concentrating on tasks, and procrastination. These avoidance behaviors reinforce the anxiety cycle, as the person never gets a chance to face their fears and, thus, reduce them. These symptoms can be mild, moderate, or severe, depending on the individual's personality, life context, and experiences. 5. Strategies and treatments for managing anxiety. There are various approaches to treating anxiety, and often a combination of methods yields the best results. Natural interventions, mindfulness and meditation practices help calm the mind and allow individuals to develop better control over their reactions. Deep breathing exercises, physical activities, and the use of natural supplements like L-theanine, valerian, and chamomile are recommended to reduce symptoms. We'll include some supplements with incredible compounds in the video description, great allies in fighting anxiety. Psychological therapies, cognitive behavioral therapy, CBT, is widely used to treat anxiety. CBT helps people identify and restructure negative and distorted thoughts. Other approaches, such as acceptance and commitment therapy, ACT, are also effective in helping people accept their condition without self-judgment. Medication. In more severe cases, medication may be necessary to stabilize symptoms. Antidepressants and anxiolytics are often prescribed, but it's essential they be used under professional guidance, as they can have side effects and, in some cases, lead to psychological dependence. Each approach plays a role, and treatment choices should be individualized, respecting the patient's needs and condition. 6. Self-care tips for everyday life. Daily self-care can help reduce symptoms and prevent anxiety from becoming disabling. Some practices include adequate sleep. Sleep is vital for emotional balance. Maintaining a regular sleep routine and avoiding stimuli like electronic devices before bed can significantly improve mental health. Regular physical exercise. Engaging in regular exercise, like walking, yoga, or running, increases the release of endorphins and serotonin, which helps alleviate anxiety and boosts mood. Balanced diet. Avoiding substances like caffeine and refined sugar, which stimulate the nervous system, and opting for a diet rich in fruits, vegetables, and proteins can improve emotional stability. Meditation and relaxation. Techniques such as mindfulness and yoga help the mind focus on the present, reducing anxious thoughts. Regular practice of these techniques can have lasting positive effects. 7. When to seek professional help. In some cases, anxiety cannot be managed with self-care alone and requires professional intervention. Some signs that it's time to seek help include persistent difficulty completing daily tasks due to anxiety, self-destructive thoughts or constant feelings of hopelessness, frequent episodes of panic, paralyzing fear of social interactions, or avoidance of activities that were once normal, a sense of being out of control, even when trying self-care techniques. Professionals like psychologists and psychiatrists are equipped to provide support through therapy or medication, promoting the individual's well-being and recovery. So, everyone, did you enjoy the video? Anxiety can be a challenge, but with the right treatment, support, and some lifestyle changes, it's possible to live more peacefully and in balance. If you or someone you know is dealing with anxiety, remember that seeking help is the first step to a better life. Feel free to comment on what you'd like to see more of on the channel. And if you think this video can help someone, share it with them. Thank you for watching, and see you next time.